just spent several days here at Chatsworth Family Dentistry with the lovely Anissa Downey and Brooke Kofelt, the office manager. And I wanted to get some feedback from you guys on how you feel like you've done with the Classic Practice program.
We started with Classic Practice back in 2013. I came on as the new manager. Have never worked in dental or as a manager for that purpose. And my husband owns the practice, and so I was at least smart enough at the time to know that I needed more help than I could, do for myself. So we reached out to Sandy and had a really good lengthy conversation with her, and after speaking with her, we decided that we would do the year program. And we were in a really bad place. It was
I remember.
it was difficult.
Yes.
I'm so sorry.
No, that's okay. It was rough. It was rough. You want to start over?
No, I'm good. So anyways, we had to make a lot of changes, and they were difficult, but in that year time frame, we brought our AR down from over 90, that was 100,000, down to less than 10 in that time frame. We also had so many broken appointments. We were averaging 10 to 15 a day, down to about 3 and 5, which was obviously a much more manageable number to deal with.
Yes.
We did have to make some staff changes, unfortunately, but each of those we were able to place with some great members who were very receptive to the training and that have continued to be with us since then and has increased. And since that time, the practice has flourished. We were in a very deep hole, so the training from Classic Practice gave us the systems and procedures that we needed to build the foundation that we needed to grow on. We did not have that. We were not streamlined. It was chaotic. It was a mess. I had no idea how to track anything as far as numbers or any kind of documentation to see in which direction we were going. So it was such an eye-opener for all of us to see the progress. It was an encouragement to understand how to do that and to see those numbers climb and grow, and we've done so over the past 5 or 6 years. I think at the time we might have been at like 1.5, 1.6 in production total. Now, this past year, we've closed out at 1.9, which was a big increase for us. We've added another provider. We've added another hygienist because our growth has increased. But we were in a situation to where it was time to turn the spotlight from the front, that we felt like we had finally accomplished everything that we wanted to do, to the back. And Brooke and I looked at many different things online, different programs and different things and just nothing ever quite worked with what we were wanting. It had the same philosophy that we were looking for, or that really even addressed the assistants. We could find things occasionally with hygiene, but nothing with the assistants. So that's when we were talking, we decided to reach back to Classic Practice, who had helped us so much with the front, and see if they could provide the help for the back. And spoke with Sandy, and she agreed to allow us for you guys to come and to help us specifically with the assistants and with the hygienist. And that has been phenomenal. This is quite honestly the first time that we've been able to have someone reach our hygiene department, and for them to respond in such a positive manner. I think in the past, although the training was excellent, it was more geared towards the members of the front.
Sure.
It wasn't geared towards them specifically and how they reach their patients and how they speak to their patients, and why the numbers were important for them specifically, not just the office as a whole. Same for the assistants. I think that was something important for them to understand their role in the dynamics of the practice and how they specifically could increase that, not just show up and flip the room and assist the doctor, but how they could make the impact that was needed. I'm not just saying this, we could not have done it without the systems of Classic Practice. We still rely on many of those. We still have a lot of the same forms that we follow. It works. There's no need to change that for us. Those systems have really helped us streamline and cut out a lot of fluff that we didn't necessarily need or understand what we were dealing with, and it makes our days much more productive and smoother to stay on.
The assistants are doing really well, the best they've ever done. Hygiene as well. Just within the past few months, our perio has really increased, which is one of the areas we were low in that we wanted them to increase in. We all knew that we were struggling in that area, but we didn't know how to help them. Thankfully for Therese and Denise, you guys they did good. You worked with us so well. And the girls,
it was a pleasure.
they were excited for you guys to come back this time. They didn't dread it by no means, because they have seen the accomplishments, the reward, the growth, and they are eager for more. So we're excited to keep this going. A long time ago, when we first got the red books, they were a little bit overwhelming because they're so
much
big and
change.
I know that feeling.
Yes. However, we still look at them. We still go back to them.
They're great reference books.
Yes, there is. And the girls and I up front especially, we use them all the time. And we've got some homework to do still with the assistants, but they feel included. It's so nice for them to be a part of something, because the front, we can train them all the time. Training for the front is easy to find, and they're normally the easiest to put it in place.
Sure.
However, clinically is harder, just because there's not much stuff, there's not many resources out there that matched our philosophy and the training that they needed. So we've been very satisfied. I'm sad we're almost to an end.
Yes. Very
with you guys, but hopefully the girls will still strive to do everything that you've told us.
And in the last 6 months, since we've been with you guys, we've had our largest year, our largest month, and our largest production day. So that's encouraging for everyone to see that. And so we've got some lofty goals for this next year. Some big ones that we've never put in place
And I'm
before.
sure you'll see those goals achieved.
We are seeing them. We're seeing them already. So
That's
it's very rewarding to see the change and to